Before providing you with a definition of knowledge translation, we first need to understand why we need knowledge translation. And it is because there is a gap between the most recent advances in research and their application. That means between what we know and what's get done. In health research, it usually takes 17 years till the first outcomes of research are implemented in practice. In public health, it can take even longer, or sometimes some outcomes of research are not implemented at all. However, when principles of knowledge translation are applied, this time can be reduced to some 3 years. So basically, knowledge translation is ensuring that stakeholders, that means policymakers or practitioners, are aware of and use most recent advances in research to inform their health and healthcare decision making.
We've learned from evaluations that really the best way to translate evidence to policymakers is in direct face-to-face dialogue with them. It really enables a good exchange of information, not just the evidence part, but also the information about what are the implementation conditions, what is the level of policy support for this key message. And this also requires a trusting relationship between the researchers and the policymakers. So it does require some time to invest in relationship management. And then in the end, it's important to present the findings in a more coherent narrative rather than just presenting charts of figures, to also provide the policymakers with a storyline that really gains the political support they need to achieve their policies.
I personally have most experience with the World Health Organization, as I have been a member of several technical advisory groups and committees. I find collaboration with the WHO in this field to be very effective because of their excellent network and great style of collaboration with the national ministries of health. I also had a chance to observe the work of the European Commission and in particular the European Initiative on Breast Cancer, which in my opinion is one of the best model examples how to perform knowledge translation with regard to prevention, diagnosis and treatment. Finally, I believe that we should encourage knowledge translation not only at the international level, but also at the national level. And as such, I serve as a consultant also for the Slovak Ministry of Health and the National WHO Office.
I think there are a lot of ways to enhance knowledge translation, but I think we can also learn from the public affairs management. First of all, besides our regular business of collecting evidence, we should also invest more time in collecting intelligence about the important stakeholders and their priorities in the policy setting that we're working in. Secondly, I think it's also important to link up our evidence and facts to the values that are hotly debated and to see if there are other values that we can link up our health value to make it stronger. Then thirdly, I think it's important to invest in a free space where policymakers and researchers can freely debate the concerns, the issues, and maybe even some contestations. And then finally, I think we should also give some more consideration to the position of our politicians. They really need our support. So we should allow them to take the credit or avoid the blame.